Good morning, dear friends and colleagues. I'm Dr. Vineet. I'm a consultant neurosurgeon who's practicing in New Delhi. I am more specializing in neuro-oncology and neurospine. Today, we'll be talking about a very small but very important topic, which is low back pain and neck pain. Though it is not a common disease, but it is prevalent with everybody. Most of it is of no consequence, but majority times we ignore and come to know and treat it at a very late stage, very advanced stage, where the results and the disease would have taken a very ominous condition. For गले में दर्द हो, पेट में दर्द हो, फर्क नहीं पड़ता, इग्नोर कर दिया, एक दिन, 2 दिन, ठीक है, पर कब and when, for example, should it be taken seriously? When should a neurosurgeon or neurologist should be consulted is what I am going to talk to you about. You have neck pain, you have back pain, fine. You have neck pain, it might be severe. If it is a sudden onset, or there is any bowel problem, urine problem, if there is any weakness, any movement, any sensation loss, or any difficulty in walking, you are slipping, or the pain is very sharp, and it's unrelenting with lot of medication also, then is the time to consult a doctor pronto, immediately. And that also you have to consult a neurosurgeon specifically so that it can be taken into due consideration and the worst scenario can be tackled with. Surgery is not something which is a feasible or a preferable option for most, but it is definitely in today's world a safe method to treat the diseases only and when it is required, especially in these extreme conditions. You should know, for example, there is a low back pain. This is your spinal cord. This is the spinal canal. This is the whole body, and in this you have a spinal canal. When these nerves coming out from this are compressed, that might cause a loss of that nerve, loss of the function of that nerve, which might be you might lose the function of your legs, you might lose the control of your bowels or your urine. So this is not something you should ignore. You should be taken, thoroughly investigated. If it is a simple back pain, muscle pain with no compromise of the nerves, then it can be well treated by the right exercise and physiotherapist, which can be further advised by me or a fellow neurosurgeon. What you have to recognize is this cord, or for example, if there is a neck pain, this is the skull and the neck bones go from here and the spinal canal is inside and nerves go from here. If any of this is badly compressed by either a disc, which is seen in blue, or a slip off or a fracture, then that has to be treated immediately. You cannot go on with a long-term pain or a deficit which will lead to a loss of that function. So what you have to remember is that if there is a pain which is persisting very long, or there is a red flag sign like no pain relief in spite of medication, any difficulty in walking or movement of the hands, any difficulty in gripping, any difficulty in urination, bowel problem, or there is loss of sensation, immediately consult. Immediately consult means you consult, we investigate, whether that be, how do we investigate? First we examine, how objectively is there a deficit? Then we investigate, that is by a nerve test and an MRI or a CT scan of these bones and nerves. If these all are within normal limits or there is only a mild deficit, then we can treat it with medicines or exercise. But if they show a significant compression or significant disturbance to the nerve, then they have to be treated surgically, which is a safe and feasible option. For example, a disc slip is there. Patient might come with a severe pain, difficulty in urine bladder. Same day or the next day they are operated, a disc is removed. That is through a small incision, maybe a 1 cm, 2 cm incision on the back. You can go through an endoscope or a microscope and remove it. Patient will be walking the next day. 2 days later, they'll be home doing the normal activity. Untreated, few weeks or month, there will be loss of that function and never to recover. This can happen to any individual of any age group. Same thing with the neck thing. It could be a disc, it could be a nerve compression in old age. We operate on a 14-year-old to a 92-year-old, depending on how good they are in function. The operation is done only when it is essential. But by consulting a neurosurgeon or a physician who knows what they're doing, you can rule out a severe disease before it becomes irreparable. The spine vertebrae are there. They can be treated by a 1 centimeter incision from the front or back, and using a microscope or endoscope, that compression and nerve will be relieved, and for which you will be pain-free, symptom-free, and the nerves will be saved. Instead of coming to a surgeon at a very late stage when you have lost the ability of that foot or the hand, come to them early, and then once you have ruled out any serious condition, you can later get treated by the same person medically or with exercises alone. So, ladies and gentlemen, I'm Dr. Vineet, and once again, neck pain, back pain is something which has to be taken seriously under consideration, and do not ignore it. It can be treated safely, well, and you can be pain-free in no time and symptom-free. This will preserve your nerves and ensure that you have a good quality of life for then on, and you will not require a doctor, and good exercise and good lifestyle will prevent any further damage also. Thank you very much. You can consult to me through the website, through Librate, and I will be at your beck and call and to hopefully treat you well. Thank you very much.